Right now, we're joined by
Yeah, my name is Dr. Albert Garcia-Romeu. I'm research faculty at Johns Hopkins School of Medicine.
and has been focusing on the area of psychedelic research, especially psilocybin research and addiction. Dr. Albert, welcome to the program.
Hi, how's it going?
Good, good. So psilocybin and addiction. Let's just get straight into it. You've been doing a some research into how the psilocybin experience, the psychedelic experience elicited through that, can help people break patterns of addiction, specifically with tobacco. What's how's your research been going there?
Well, so far we've done one small pilot study in 15 regular daily smokers who wanted to quit. And we published those results last year, and we're working on publishing the long-term results currently. But basically, the take-home message from the first small pilot study was that in about 15 heavy regular smokers who wanted to quit, using psilocybin in combination with some more established treatments like cognitive behavioral therapy, um, ended up being very effective for the people that we worked with. And so about 12 of those people were no longer smoking at the end of the treatment. And then about 6 months after their target quit date, as we call it, they were still not smoking, so they're still abstinent. So that's about an 80% success rate, which in smoking cessation research is not very common. Usually people using some of the state-of-the-art medications will get maybe 30 to 35% of the individuals who take those medications to successfully quit smoking. So we think that the results are very promising, and so we're currently doing a randomized control trial, which is more carefully, more rigorously conducted uh, trial in which people will be put into one of two treatments. One will be psilocybin, and the other will be just the use of the nicotine replacement or the patch.
So run us through what actually the treatment is all about. What happens to somebody? Say I'm going in and going to be part of this the treatment program. Obviously, psilocybin is a part of it, but what else do patients go through?
So as I mentioned, there's a component which is really the kind of backbone of the treatment, which is called cognitive behavioral therapy. The basic premise of that is that by examining the way that people think about and behave in relation to their smoking, that they're able to make some minor changes that will help them along in terms of getting abstinent. And so the cognitive behavioral therapy is a pretty standard talk therapy that you do. And in addition to that, we also do a sort of rapport building in which we get to know the participant, the people who are going to be guiding the psilocybin session, because it's important that there's a sense of rapport in order to do a therapeutic psychedelic session. People need to feel comfortable, obviously, with the guides or with the study treatment team that they're working with. And so, we do a lot of preparation in terms of getting to know the volunteers and understanding their life story, where they're at in their life, and what they're looking for in terms of quitting smoking, but any other things that are you know in the front of their psyche at the time. Because if they're going through a breakup, or if they're in a job they don't like, those things, even though they're not the focus of the therapy, can certainly come up, obviously, in a psychedelic session. And so we want to be well situated and have a good sense of where the person is at when we do that.
So what does the in this overall cognitive behavioral therapy through those sessions, what does the psychedelic experience add to those that you couldn't achieve with just the cognitive behavioral therapy?
So it's hard to say right now. We don't have a very precise answer for you, and we've been spending a lot of time interviewing our participants in retrospect to see what they thought of it, as well as writing our own theories, which are out there and published. So if you're reading peer-reviewed research, we've been writing about this because we have theories, but we don't know for certain. Um, but the main thing that seems to be playing a role in helping people quit through the psilocybin is um, a sort of, well, we use the term mystical type experience, but people have a very profound and personally meaningful experience under the influence. And that seems to help them um, reprioritize things such that they're able to realize the relative worth of the cigarette smoking in their life and the relative worth of all the other things that they have to gain. And that provides some additional and needed motivation for them to make the change, to becoming a non-smoker. And many times for people, it all of a sudden becomes a non-issue. I think one of the um, things that we hear over and over again is that um, they realize that smoking is not important to them, and that being with their family is important, or their health is important. And so when they have that very profound, personally meaningful experience under the influence, they come back and say, "Okay, now I understand, what matters to me, and smoking is not one of those things." And I think really, to use a metaphor, the cognitive behavioral therapy is sort of going into the garden and weeding and really knocking the dirt around, getting it ready, planting the seeds, and then the psilocybin session is something like a big monsoon or storm where the water and then afterwards the sunlight comes out and really helps those seeds to begin growing.
You're listening to 3CR. This is in Psychedelia on 3CR. 3cr.org.au is where we're streaming live, 8:55 a.m. If you're in Melbourne, and also on digital. And right now we're speaking with Dr. Albert Garcia-Romeu, who is from Johns Hopkins University School of Medicine, research associate and postdoctoral fellow, and he has been recently conducting research into using psilocybin from the psilocybe mushrooms, the magic mushrooms, as part of an overall psychedelic therapy program to break people's addiction, specifically to break tobacco addiction. Presumably, if it can break one kind of addiction, it sounds like it's not really interrupting something physiological with people's relationship to tobacco. It seems to be about people reanalyzing their relationships to themselves and the world around them, and this is a common thread through psychedelic experiences, I think, that we see described in, say, the vaults of our Erowid through the various experiences there. But obviously, using the therapy model as well, you can kind of you counter against any of the most of the negatives that might be associated with some experiences, the anxiety experiences, or it's not just giving people some mushrooms and telling them to go to a rave and then they should just finish smoking, is it?
Yeah, I think you made a couple of very good points. One is that this is not specific to nicotine or tobacco addiction. This model seems to hold true for a number of different drugs of abuse and potentially other kinds of compulsive behaviors. So, and that has been demonstrated by my colleague Dr. Michael Bogenschutz's recent pilot study using psilocybin to treat alcoholism, as well as a lot of research in the past, in the 50s and 60s and 70s, using LSD to treat alcoholism. Sometimes quite successfully. And also, my colleague, Dr. Peter Hendricks at the University of Alabama at Birmingham, is doing the first ever study using psilocybin to try to help treat cocaine addiction. So we do think that this can translate across drugs of abuse. It's not a physiological effect that would, for instance, have anything to do with the nicotinic acetylcholine receptors, which is where tobacco and nicotine, exert their effects. But it does have a physiological effect, literally, on the sense of self that the person experiences acutely when they take the drugs. And the researchers who are working out of Imperial College in London, Dr. Robin Carhart-Harris and Professor David Nutt in particular, have done a lot to show that in general, when we're doing our day-to-day life type tasks, our sense of self is um, very much wound up in certain networks, activities in the brain, and some of those are, central hubs become um, their activity is decreased by the drug effects, and what you see then is that the normal sense of self is altered, which anyone who's taken a psychedelic would probably know. But through that alteration, I do think that there is an ability to, in focused therapy and treatment, as you said, not necessarily if you're taking this recreationally, but if there's an intention and there's a focused treatment, I think that that alteration in the sense of self allows a window of opportunity to make very meaningful changes in a person's life, like quitting a drug of addiction, for instance.
So, do you think there is a leading theory, or are there several leading theories at the moment for why what it is about the psychedelic experience which is allowing people to change like this? What it is that happens in there?
I mean, there's lots of different types of theories. One of them, which is related to that work I was talking about in the neuroscience, specifically the effects of psilocybin and other psychedelics on what they call the default mode network, which is a network of different regions in the brain. And the thinking there, as I mentioned, is really that by changing the person's sense of self temporarily, that it may help sort of reset the brain in a way, so that a person who, for instance, is very depressed, or a person who's addicted to some substance, is able to get temporarily out of that, have that addiction or that depressed thought pattern be interrupted long enough so that when they come back, when the drug effects wear off, they're able to gain a foothold and move their kind of mental life in a direction that they choose. Another hypothesis that I've kind of published recently, and I think is an interesting one, is that what we seem to see here, especially with what we're calling these mystical type or transcendent experiences that people have under the influence, is that they have an effect during the drug, during the drug action, which lasts 6 to 8 hours, but they have these long-lasting effects afterwards. And usually in biomedical research, if you're thinking about something therapeutic, for instance, if you get sick, you usually have to take some sort of course of medication. Over time, you get better. But in terms of post-traumatic stress and PTSD, you actually have a very solid model in which there's a particular occurrence or event that happens. It's time limited. So, for instance, if you're a combat veteran and you're at war, and you might see something awful or something terrible might happen to one of your brothers in arms, that one time limited experience can have long-lasting ramifications and repercussions down the road. We know that actually that one single very powerful event can actually cause changes in the wiring of the brain, and can also have these very detrimental effects in people who have and suffer from post-traumatic stress. And I think that in some way the psychedelic experience, and particularly these mystical type experiences, seem to work in the opposite direction. So they're very short time-limited events that have these long-lasting beneficial repercussions for people. And one of the things that we see over and over again with the smokers that we've worked with, for instance, is that when we have them come back to talk to us, they say, well, yes, I quit smoking. I haven't smoked in 2 or 3 or 4 years now, and that's great. But it's also affected my relationship with my mother, with my spouse, with my children. It's changed the way that I approach my work. My appreciation for music has really, taken off in a way that I haven't had since I was in my teens. So these other benefits come about a lot of times for people, and I do think that putting it in this sort of inverse PTSD model is the closest that I can come to explaining it to, for instance, a medical doctor who doesn't really understand how a short drug-induced experience can have these lasting ramifications.
You're listening to 3CR Community Radio. This is Enpsychedelia, and we're speaking with Dr. Albert Garcia-Romeu about psilocybin and addiction. But I just wanted to ask you finally, if you've got any words of advice for anybody that's listening that might be a fledgling academic sitting at university in a undergraduate and wanting to do something, maybe they have some interest in psychedelics and they want to do something. How can people get involved in this area that's still relatively controversial and still has a lot of taboos attached to it?
So firstly, I've written a piece which specifically addresses this question, and so I would direct anyone who's interested to look it up. It's published by MAPS, the Multidisciplinary Association for Psychedelic Studies, who commissioned the piece, asked me to write it, and that was published last year. But the main points in that there were several. One being that if you're in academia, that's one particular way in which you might become involved in this. And right now is a very exciting time for this field because, we've just seen the first human study of LSD in about 40 years that was conducted by, Peter Gasser in Switzerland. We're seeing more clinical research with LSD, more clinical research with psilocybin, interest in drugs like ayahuasca, MDMA, salvia divinorum, ibogaine. So there's a whole, and not to mention cannabis. So, I mean, obviously there's a whole gamut of drugs that are out there that for some time were considered basically drugs of abuse with no real medical potential. And there has been somewhat of a sea change in that certain prominent and respected scientists, such as the ones that I had the pleasure of working with here, like Dr. Roland Griffiths and Dr. Matt Johnson, have taken the ball and really started to run with it. And so we are seeing, for the first time in decades, carefully conducted clinical trials and also other basic neuroscience research conducted around these drugs. And so if you're a fledgling academic and you have an interest in the field, there's certainly lots of excitement in certain regions. And if you follow through with getting either some sort of clinical Ph.D. in psychology, an M.D. in psychiatry, Ph.D. in pharmacology, neuroscience, there's lots of different ways of getting into the field. But I also think that it's important to reach out to the people who are doing this work. Most of them are quite busy, but they're also for the most part, the ones that I've spoken to are very open to talking to and encouraging young researchers and scientists who want to, contribute to the cause. And I think that, academia is a very narrow focus, and so there's not a lot of people want to go get their PhD in pharmacology or, do that kind of work per se. And so I think that there's lots of other ways that people can get involved. So doing things like working in harm reduction or policy type organizations. So we talked a little bit ago about the Drug Policy Alliance, and there's also groups like Dance Safe, the Zendo Project. These are groups largely that are based in the U.S., but I'm sure there's lots of similar groups.
Similar groups in Australia. PRISM is the Psychedelic Research in Science and Medicine. EGA runs conferences, psychedelic conferences around Australia, and we've got DanceWise in Victoria, which is quite similar to Dance Safe, probably less resourced, but similar sort of concept.
Right, and so those types of groups, as well as there's also student organizations like Students for Sensible Drug Policy. So there's all these different ways that people can get involved that I think are really excellent outlets for folks who are interested in this area. And I think the other thing that that's important is to, as I wrote before, is to kind of be a psychedelic citizen. And what that means is to take the insights that you find so compelling from your own experiences with these substances, if that's where you're coming from, and really live from those. So I think that Dr. Albert Hofmann, who's the discoverer of LSD, really saw that it wasn't just about the drugs and taking the drugs recreationally, but it was about a transformation of consciousness, if you will, a change in the way that we relate to one another, and that is an important insight that people can live in their day-to-day lives in terms of the way that they deal with the people around them. So, I mean, it sounds silly, but being kind and compassionate to the people and the animals and the ecosystem around you are just as psychedelic as going to raves or parties.
Absolutely. Absolutely. And Dr. Albert Garcia-Romeu, thank you very much for joining us on Psychedelia today.
My pleasure, Nick.